A huge number of people lose perfectly healthy teeth simply because they ignore one small detail. The gum recedes, exposing the root, and then everything just snowballs from there. Sensitivity, cavities, inflammation. In the end, the tooth has to be removed. You start to notice that your teeth seem to have gotten longer. Even a slight breeze of cold air feels like an electric shock. The toothbrush keeps scratching the same spot, and it feels like the gum has slipped down. But it's not too late yet. If you understand what's happening now, you can avoid surgery, pain, and losing healthy teeth. Today, I'll explain why gums recede, what happens to a tooth when the root is exposed, and how you can stop this process while the tooth can still be saved. And even if your gum recession has already started, there is a way to bring the gum back. What is gum recession? It's when the gum recedes, and we usually notice it ourselves only by the first signs. A yellow border appears right below the tooth. That is where the enamel ends. And this yellow border is nothing other than the cementum of the tooth root. In other words, that's already the root of the tooth. Why is this bad and what are the risks? Such an exposed area of the gum is completely unprotected and very susceptible to cavities and bacteria, so you can easily diagnose this yourself just by standing in front of a mirror. Another sign of gum recession is sensitivity, or more precisely, hypersensitivity. When a patient reacts to various irritants, such as sour food, salty food, sweets, or to temperature stimuli like something very cold or very hot. I would also like to add that patients who already have gum recession can actually feel it with their tongue. And very often, patients describe it exactly like that, saying they feel some kind of step or roughness. This is precisely the transition between the end of the enamel and the beginning of the tooth root cementum. And let's say the final stage of gum recession, or an advanced stage of gum recession, is of course a loose tooth. When our tooth completely comes out of the ligament that once held it in place. Most often, such teeth end up being extracted. And the main thing is, these teeth can be completely healthy and not affected by any cavities at all. That is why it is important to monitor your gums and gum recession. If you have experienced these symptoms, please share in the comments how you noticed them and what you did about it. I'm sure many people will find it helpful to read about the real experiences of actual patients. It also causes aesthetic discomfort. What does that mean? It means that when the patient smiles broadly, they start to notice this yellowish border at the bottom of the tooth. Other people also notice this border. What should you do if you notice gum recession? First of all, you should definitely make an appointment with a dentist for a consultation. Secondly, I would pay attention to the toothbrush you use, how soft or hard it is, and whether you are brushing correctly. Because gum recession is also very often caused by improper toothbrushing. And of course, improper brushing also attracts bacteria. In other words, an inflammatory agent. When we brush our teeth incorrectly, plaque accumulates around the tooth, and this plaque calcifies and turns into tartar. And it is precisely this tartar and infection that also lead to gum recession. If you want to learn how to brush your teeth properly, watch this video. There are 3 stages of gum recession, or 3 degrees of gum recession. These are mild, moderate, and severe. They differ only, let's say, in size or depth. In the mild stage, the gum recedes up to 3 millimeters. In the moderate stage, the gum recedes from 3 to 5 millimeters. And the third, severe stage of gum recession is when it is more than 5 millimeters. At the first stage, it is often enough to determine how well the patient brushes their teeth and whether they are injuring the gum during brushing or not. It is also usually sufficient to have a professional dental cleaning done. This is when the dentist removes the dental calculus that leads to this recession. Therefore, the main thing is to remain under observation. In cases of moderate and severe gum recession, it is most often a surgical intervention and operation called gingivoplasty or mucogingival grafting, where a small piece of gum tissue that is a graft is taken from you, most often from the upper jaw, and is sutured directly to the area where there is not enough gum.
So, to restore my gum, they take a piece from another part of the gum?
Not from the gum, but from the palate. Most often, yes. A piece is taken from the upper palatal piece of mucous tissue.
And what about there? What happens to it?
It heals afterwards, everything recovers and regenerates just fine. In a month, you won't even be able to tell anything was done there.
It's not dangerous, fine.
Absolutely, yes. The oral cavity heals very quickly. It's one of the fastest healing mucous membranes, so it absolutely won't cause you any discomfort. That's the most important thing. It's completely painless. After we've performed this kind of gum grafting, following the procedure, your new gum will serve you just as well as your original one. And most importantly, it will protect your tooth from further damage and save it from extraction.
So, if I have gum recession, I won't be able to figure it out myself. I'll have to see a doctor. There are no other solutions.
100%. You definitely need to see a doctor. Once again, only a doctor can determine the degree of gum recession, and only a dentist can provide the necessary help. No home remedies will help you, that's for sure. If recession has started, it will continue. Recession can only be stopped.
And how can the process be stopped?
Sometimes, as I said before, gum recession, especially in its early stages, is very often caused by what's called a traumatic factor, meaning that the person is brushing their teeth incorrectly. There is also another theory, it's called the nervous theory, where the patient grinds their teeth at night, a condition known as bruxism, which leads to excessive stress. The patient constantly clenches their jaw, even while resting or sleeping. Certain, let's say, high-stress specialties or professions, yes. If you want to see a video on how to take care of your gums at home when you have recession, be sure to give this video a like. Take care of your teeth and follow our channel. Subscribe. See you next time. Take care of yourself and your loved ones.